The Heart Rhythm Society's 40th annual scientific sessions in the great and noble city is underway, bringing health professionals from all over the world to learn about the latest in electrophysiology. Heart Rhythm TV starts right now. Hello and welcome to Day 3 of Heart Rhythm TV. I'm Dr. Kevin Campbell, ready to bring you everything you need to know from this year's meeting. Today, we explore the Digital Health Summit, a late-breaking clinical trial, highlight some of the organizations around the world that are dedicated to improving the care of patients with heart rhythm disorders, and so much more. First though, the Digital Health Working Group Chair.
The Digital Health Summit was the production of the Digital Health Committee that was initiated this year by HRS. And we have a wave of mobile health users or consumers. I'm calling them the future partners or patients of ours. It's time to jump on the train and start tackling these issues. So for that reason, the Heart Rhythm Society put together the Digital Health Committee, in fact, and assigned our first task to us to put together a Digital Health Summit, to have a group of entrepreneurs, of tech giants, of patients, which is center of the whole action, physicians, EPs, non-EPs, and scientists in one room to discuss this new wave in medicine. The health tech giants, or non-health tech, but the tech giants in general, has been pushing this into consumers' hand, and patients have been using this on consumer, and they come into our clinics and practices, and now we're sitting there with massive amount of data looking for solutions. As a Digital Health Committee, we are tasked with trying to refine these processes and connect better to our patients, working together with the tech giants, with the industry, people working on these platforms or softwares to help us better serve our patients.
Wearables and digital health are taking the healthcare industry by storm. Let's take a moment to learn more about where it stands and what the future looks like. Today, I'm with Dr. Suneet Mittal with the Valley Hospital. Dr. Mittal, thank you for being here and welcome to the show.
Thank you. Good morning.
So tell me a little bit about the current state of wearables in electrophysiology today.
Well, Kevin, I would say the best way to look at the current stage is to take a walk down the exhibit hall. Who could have thought that the exhibit halls for the companies selling wearables would be as large as the exhibit halls for the conventional device and ablation technologies? What that really speaks to is the fact that I think HRS 2019 will forever be known as the convention where digital and wearable health basically came to the forefront. And it reflects the fact that our patients are really engaged. They're consumers of healthcare and also users of healthcare. And we're seeing a great desire to get this physiologic data. And of course, the lowest lying fruit is ECG, the rhythm, atrial fibrillation, and everything that goes with it. And so this is where we are today in a very exciting time.
I have to agree with you. You know, it's amazing how many wearables we're seeing. But with those wearables comes lots of data. What do you see as the biggest challenge for electrophysiologists today in dealing with all these new technologies?
Right, there's a lot of signal, there's a lot of noise, and what you want to really get a sense for is what's valuable, what's cost effective, what's actionable, and what's going to contribute to better care, not just contributing to anxiety and misdiagnoses. And I know that we want the perfect system from the get-go, but listen, there are always going to be learning pains, and that's where professionals like us, experts like you, who are committed to this space, have to do a good job of trying to get the value proposition out and minimizing the potential for harm. So it's going to take some time, but we're seeing our colleagues do the first group of studies. These studies are exciting. They're telling us what the next step is. They're asking us to ask more questions, and eventually, like everything else, we'll refine this to a way that is quite manageable and effective for our patients.
Well, how do you think that the Heart Rhythm Society can support us and our patients as we embrace this emerging technology?
Well, I think HRS has done an amazing job in already doing that. I think a couple of days ago, we had the pleasure of participating in the first ever HRS Digital Health Summit, where it brought in not just doctors, but patients, technology groups, and all the stakeholders that are involved in this space, because it starts with a conversation. We have to think about it not just from our standpoint, but hey, what's the standpoint of the patient? How about for the app developer, for the person who's developing this technology? Get them in a room, start that conversation. And I think that's what HRS's role is, to really think about it. We're a global society, so we're also a society of various stakeholders, and they're helping us lead this effort to really help. And again, I think 2019 is the year this all came out.
You know, I can't agree with you more, and I'm excited for what the future holds for us in this space. And I wanted to thank you for taking time to come and stop by Heart Rhythm TV today.
Perfect, thank you.
The hot balloon, originally invented by Dr. Shituro Satake, a pioneer of Japanese cardiac electrophysiology and catheter ablation, was developed after a clinical investigation exclusively done at the Hayama Heart Center. Now it is distributed on a commercial basis throughout Japan. Let's take a closer look at all of the work being done at the Hayama Heart Center.
ホットバルーンの開発は15年前から始めました。ホットバルーンというのはですね、カテーテルの先端に非常に柔軟性に富んだバルーンがついておりまして、中に高周波通電用の電極と熱電対が入っております。で、熱電対でバルーン内の温度をモニターしながら、外から振動波を加えまして、バルーンの内部を攪拌します。そうすることによってバルーンの温度は均一となります。私的な温度で時間をかけて焼灼することによって完璧性にですね焼灼が可能なんですね。でこれまでの電極カテーテルだと血栓とか栓痕が起こったんですけど、そういったような合併症はありません。
このホットバルーンは非常にシンプルなシステムであるということです。シンプルであるということはオペレーターにとって非常に使いやすいということになります。従来のアブレーションではいわゆるポップというものが必ず危惧されておりましたけれども、このホットバルーンにおきましてはポップの心配がありません。他のアブレーション技術と比較してホットバルーンが優れている点は圧倒的に焼灼面積、アブレーションの面積が広いということです。
葉山ハートセンターは、2000年に開院しまして、当初から心臓手術を中心にやる病院としてやってきました。
ホットバルーンの成功率、治癒率は1回で98% ですね。1年間は 98% が発作がなくなります。で 90% は薬剤も不要となります。
2回目のアブレーションを受ける割合が圧倒的に少ないという点にあります。
病状はですね、10年ぐらい前から少しずつ脈の乱れが始まりまして、ホットバルーンに関しては全く無知でしたので、ちょっと不安もありました。でも今回受けてみて、2日3日1日1日体が楽になってくるのが分かりました。今はもう本当に元通りみたいな感じですね。
初めにホットバルーンの聞いた時にびっくりしました。昔だったら胸を切り開いて大変な手術をしなきゃいけないのに、穴が2つ開くだけで非常に 不安がない、手術だなというふうに思いました。麻酔打ってもらって目が覚めたら終わってましたから非常に楽でした。
葉山アートセンターは最初心臓病専門の治療機関として、非常に快適な環境の下で患者さんの治療に専念するという趣旨で作られたものですね。非常に海の近くで空気がいいと。で、そういったことで患者さんの治療には最適な場所だと思います。
何ですか、ホテルのような快適に過ごせる病院なので気に入りました。
昔も診察受けたことがありまして、非常にしっかりした病院だなと思って安心して手術は受けられました。
今後の展開についてですけど、ホットバルーンの先端に電極がつきまして、肺静脈電位とか砂防の電位をモニターしながらアブレーションできることになります。まず、循環器デバイスの本場アメリカでやはり治験を進めたいと思います。
この高い安全性と有効性の観点からは全世界に広がっていく技術だと私は感じています。世界中のどのようなオペレーターにおいても容易に安全に、そして有効性の高い心房細動治療ができるものだと信じます。
Now let's head back to the studio and learn more about the Quality Improvement Working Group. Today we have Dr. Paul Verosi, who is with the Quality Improvement Working Group. Dr. Verosi, welcome to the show.
Thank you, Kevin.
So tell us a little bit about the Quality Improvement Working Group.
Overall, our charge really is a couple things. First and foremost, it's to serve as a sounding board for shaping the Heart Rhythm Society's quality improvement efforts around the world through a couple of methods. First, to foster a culture of quality by promoting, identifying, and connecting a global network of QI champions around the world. Second, in identifying the systems-based practices of care that improve the processes, outcomes, and really importantly, the experiences of care for our patients and for heart rhythm professionals.
You know, that sounds like an incredibly broad set of goals, and as a physician myself, I'm so glad to hear that you guys are working on these things. What type of progress has your group made this year during the first year here at HRS?
We were established in 2017 as a working group after the Heart Rhythm Society's history of having had a quality improvement subcommittee as part of health policy for years. And of course, there's been a lot of great work that the Society's done for years in things like working with registries and developing performance measures, coordinating with CMS and others. But really, our goal was to try to raise the level of awareness and expertise in the Society with quality improvement and the systems-based practice improvement thinking. We're doing that in a couple of very specific ways, and those really come down to both thinking about quality improvement at a grassroots level, doing a survey of the land, of what's happening in the QI space out there, and coordinating those efforts so that it's aligned and synchronized rather than a lot of people doing individual things around the world. Second, to work on organizational change within the Heart Rhythm Society itself to do those things. Along those lines, we identified pretty quickly that improving the care around AFib, and not just in the EP lab, but overall for the care of the AFib patient, is something that's critically needed. We had an AFib stroke prevention think tank in March of 2018, bringing together a whole range of experts and emerging leaders in the field, and learned a lot, started to build that network, and in the process we've been learning about the great work that's happening around the world and seeing some gaps in care that we want to tackle. So that's the first thing. As of April of this year, the Board of Trustees voted to promote us from a working group to a full committee. We're a full operating committee within the Society. I'm very proud of our team for that. We put together a stroke prevention task force led by my friend and colleague, Dr. John Piccini. Another thing that we've done is we worked with Dr. Pingsheng Chen at Heart Rhythm Journal, and with his leadership and with our team, we put together a new feature in the Heart Rhythm Journal. It's the new quarterly EP News Quality of Improvement and Outcomes section. We have the first feature of that in the April edition. At this scientific sessions, we have a couple of exciting meetings going on. One of them, led by Dr. Tom Deering, our outgoing president of the Society, is hosting the first ever Global Quality Improvement Forum, bringing together experts and leaders from around the world in the heart rhythm space talking about these ideas. And finally, we had a think tank on establishing what the criteria should be for atrial fibrillation centers of excellence. First met at the AFib Symposium in January, and we have a session this afternoon in the program. It's going to be led by Dr. Andrea Russo, our incoming president. So the very fact that our outgoing and incoming presidents are so clearly engaged in this, I think tells you that the time has come for QI in our space.
You know, it sounds like you guys have lots of exciting things going on. What are your goals for 2020?
One of the great things about getting together a lot of smart people is that it's easy to then start seeing a much bigger picture than one person can. And I think we're starting to identify more effectively what the gaps in care and the ways that we can attack all of those, the processes, the outcomes, and the experience of care for all of us.
Well, thanks so much for being with us today. It sounds like a very exciting committee, and I think we expect great things from you and your team, and look forward to seeing you next year in San Diego.
Thanks so much.
The HRS Scientific Sessions Fellows in Training programming offers an ideal opportunity for fellows to engage with peers and key opinion leaders on topics surrounding career development and practice management. Let's take a closer look.
Fellows can expect from the scientific sessions to be exposed to a wide array of different types of sessions that are super interesting, including a plenary session that talks about the future of the Heart Rhythm Society and the future of electrophysiology, to live cases showing the latest technology in VT catheter ablation, atrial fibrillation ablation, left atrial appendage closure, really exciting networking with friends and future colleagues as well as mentors.
I think it's an exciting opportunity for us fellows to be able to meet both established electrophysiologists as well as other fellows, not just from within the US, but from across the world, and really to be able to, sort of gain a little bit of an insight as to, what their directions of practice are. We get to see both their research and also get to speak with them personally about how they run their practice and take care of patients. HRS is an amazing opportunity. It definitely highlights a lot of the new technologies and new thoughts that are coming down the pike. And I think that that's something both important for us as EP fellows. I think it's also important to reach out to both the internal medicine community, the residents, and also the new medical students that are rising up, so that HRS can, and electrophysiology in general, can be at the forefront of their career opportunities.
I would tell fellows that are just starting in electrophysiology to keep their minds open, because the field is changing so fast. The things that you're interested in at the beginning of your training may not be the same things that you're interested in at the end, and you may find something that's brand new that may be the mission of your life in the future.
Recent studies have shown that risk factor modification improves arrhythmia-free survival after atrial fibrillation ablation. Let's take a look at how a recent study evaluated the impact of pre-ablation bariatric surgery on atrial fibrillation recurrence after ablation.
So What's unique about our study is that we looked only at morbidly obese patients. So these patients we know have extremely high recurrence rates, which are almost prohibitively high following ablation. Some studies have reported rates as high as 60% at 1 year. This is the first study to date to look at how bariatric surgery impacts those outcomes. So following bariatric surgery, are morbidly obese less likely to develop recurrent arrhythmia following ablation. And what we did find was that there's a threefold reduction in the bariatric surgery cohort compared to morbidly obese patients without bariatric surgery.
Whether this is something that is related specifically to the weight reduction or to the other associated medical interventions that come along bariatric surgery, or there are some other things or other factors at play that can affect this outcome, is a question that will need to be answered with prospective trials. And that would be the next step that we will be looking at. The impact for the patient is that we are trying to find other modalities to improve the chance of them being free of atrial fibrillation.
I think at the moment, when people see morbidly obese patients in clinic, they're not the best candidates for ablation. What I think the take-home message is that bariatric surgery offers an opportunity to lose weight and enhance their chances of success following ablation.
Indiana University and IU Health have been at the forefront of researching and treating heart rhythm disorders for over half a century and continue to provide cutting-edge care to patients from around the state, region, and world. Let's learn some more about all the good work they're doing.
We have at IU Health and Indiana University been at the forefront of arrhythmias and arrhythmia research, arrhythmia treatment for the last 50 years, going back into the 1960s or so. It's a very exciting field to be in. And all this has been collaborative between our institution and many other institutions, between basic scientists, clinical scientists, and practitioners taking care of folks in the trenches.
Hello, how are you today?
We have three major principles here. One is inspiration, that gives us new ideas, innovation, that translate those into new therapies and new diagnostics, and individuality, by which we treat each individual as though they're the only person who has this disorder. Here at IU Health, we, like many other institutions, approach disease from basic science, research, from clinical science, taking care of patients, and from an educational perspective.
Here at the Coronary Institute of Cardiology, we have both basic and clinical research, as well as translational research. We have several research laboratories focused on genetics and genetic basis of heart disease, as well as cardiac arrhythmia. And there's a laboratory studying the ionic channels, as well as neuromechanisms of heart disease. And the clinical research, we expand in various areas, specifically in permanent hip bundle pacing, in catheter ablation, and pacemaker lead extraction. So these are areas that we have constantly been contributing to the literature and to the advancement of cardiac arrhythmia care.
I really work as the bridge between the inpatient and the outpatient world. My job is to marry the physician's inpatient and outpatient schedule.
In the cardiac electrophysiology lab, we routinely perform catheter ablation as well as cryoablation of atrial fibrillation. We also perform hybrid ablation with surgeons. We also have patients who undergo endocardial as well as epicardial ablations, as well as intraoperative ablations.
We foster great multidisciplinary care and pull in all the specialties to give the best patient care possible.
Here at IU Health, we have treated some really unusual situations. We've had people who have been consigned to hospice because their rhythm disturbance was just not addressable by their doctors. So can we just give us an hour or two, see what we can do for them, and then they go home and see their grandson graduate from high school. It's a life-changing thing for many of these people.
This is a comprehensive, well-structured place and a wonderful place to learn EP.
We feel very strongly that the people who are going to be taking care of us and our relatives in coming years need to be very well prepared.
The priority of education is undeniable. I think that's probably the most important thing. Starting from case conferences, literally every day, starting every morning with case conference, or interesting tracings or didactics, a journal club, every day we're starting with education being a priority.
So we have the basic science that leads to innovation, that leads to individualization of therapy, and the investment that we make in both our patients and in our trainees to give the very best of what we've got.
Since we're now in day 3 of the Heart Rhythm 40th Scientific Sessions, we want to hear from you. What gives you hope about the future of working with heart rhythm disorders?
What excites me about the future of EP is learning, innovation, new technology, growing new EPs and allied health professionals.
It's just ever-changing, and the technology is advancing, and the way that we take care of patients is always easier, faster, stronger, better, and I think that's EP is the wave of the future for cardiology.
I mean, we all share a passion for our field and a passion for innovation. We are all curious, so I think all these factors are, come to play during the interaction, and it makes our society and makes our field much better, and definitely takes it to the next level.
My hope for the future of EP is to have more women leaders in EP leading late-breaking clinical trials, hopefully in the next 2 or 3 years.
What really gets me excited is the fact that we're still at the tip of the iceberg. Every day we see something else that's helping, becoming more efficient. We're able to, again, reach more patients with online connections, social media.
These meetings that happened over the last week this year is really going to set the stage for what's to come in the next 5 years. So our future is very intricately connected to everything that we are thinking about today and everything that we had done and thought about in the past.
The CentraCare Heart and Vascular Center at St. Cloud Hospital is dedicated to the prevention, discovery, and management of cardiovascular disease. They are the largest and most advanced heart and vascular center in central Minnesota and see more than 40,000 patients in consult and follow-up each year. Let's take a closer look at all the work they do.
I was having some palpitations, lightheadedness, and then also some heavy pounding of the chest. With my ECG, they diagnosed me with Wolff-Parkinson-White syndrome, and I then had an EP study and ablation done here at CentraCare. With that accessory pathway being taken care of and having that ablation done, my risk for sudden cardiac death is out the window. It has also helped me with my pregnancy, and I would have been diagnosed with a high-risk pregnancy, and it would have been a little bit more with complications during the delivery time. Kind of a little scary being on the other spectrum of care, being here at the Heart Center and visiting with Dr. Atui. He helped me feel a little bit more calm. I was able to talk over kind of what the process was with the accessory pathway, and then again, just reassuring me that everything would go okay.
The electrophysiology division at CentraCare Heart and Vascular Center provide a comprehensive, patient-centered, high-quality care to all the patients who suffer from heart rhythm disorders. With an outstanding staff of nurses, advanced providers, and accredited lab, our electrophysiologists are able to provide an extensive care for the patients who are suffering from rhythm disorders in central Minnesota and beyond. For patients with atrial fibrillation and are not great candidates for anticoagulation, we do have a left atrial appendage program that provides a solution for them. This will decrease their stroke risk if not placed on anticoagulation.
Leadless pacemakers are an exciting technology that allow for delivery of pacing to individuals without any scar on the chest, without any possibility of complication at the chest, and that allow for arm mobility that sometimes can be restricted by a pacemaker located at the chest. So nowadays our standard is to not use any fluoroscopy for electrophysiology study and ablation procedures. And this goes for our SVT studies, it's for our flutter ablations, it's also for our atrial fibrillation ablation procedures. With intracardiac echocardiography, we can clearly see transeptal puncture and then access the left atrium. So an atrial fibrillation ablation procedure can be completely fluoroless from case start to case end.
We do have an extraction program that takes care of patients who require removal of their leads after being implanted for several years. Selected patients may benefit from His bundle pacing. His bundle pacing is an old concept, newer technology refined. It provides the patient with a better way of getting paced. This will be an alternative to resynchronization therapy and sometimes with better results.
The Device Clinic at CentraCare Heart and Vascular Center is a group of 8 nurses and 8 technicians that monitor device patients, and at this time we have just over 5,400 patients. The Device Clinic is crucial to the overall center's goal because we have crucial information that is coming from these devices that help providers manage patient care. Our clinic has been recognized nationally due to our efficient workflows, high patient satisfaction scores, high employee engagement scores, and we have hosted over 175 visiting clinics.
Our lab is central right in Minnesota, so it's kind of nice for our patients to be able to be seen from around the tri-state area here instead of having to drive all the way into the Minneapolis-St. Paul area. I think it's very crucial to have this state-of-the-art, nationally recognized program here for all of our patient population. The Intersocietal Accreditation Commission has accredited our lab. We're the 7th in the world, and we're also just the only one in Minnesota that's accredited. It's been a really great process to go through and learn what we can do to improve the quality for our patients.
When we keep our patients the main focus, we will be able to collaborate with smart teams and staff to provide them with the best care that they deserve, no matter what the challenges are.
We use a transcutaneous vagus nerve stimulation device that has an ear clip that is attached to the tragus of the ear. And it has a nerve that's called the auricular branch of the vagus nerve that is innervated in this area, and that's where patients deliver the stimulation. That goes to the brain and then to the heart. One of the key questions we need to answer is, what are the best patients? Can we find a predictor? Can we find a biomarker? Currently, we're analyzing our data to see whether we can find a biomarker, either from the ECG or from the inflammatory markers, from the echo, to optimize the selection and maximize the efficacy of this therapy. I believe this will become a mainstream therapy for atrial fibrillation, given that the number of patients with AFib is increasing, the cost of alternative therapies is too high, they have their own problems, lack of great efficacy, potential side effects if we're talking for medications. If we find the right patients, it's going to be mainstream.
The Heart Rhythm Society has a long and impactful history. What does that past look like? How has the society changed with the field of EP throughout the years, and what does the future look like? Let's find out next.
I think the 40th anniversary marks a time point for us. We build on what we've achieved in the past, on what people have taught us in the past, and the only way we can go into the future is to appreciate where we've come from and what we've learnt from the leaders in the past. And so I think marking this 40th anniversary is really an important time point for us as a community.
As a first-time attendee, it's just great to interact with all the people that I'm meeting and bring all the knowledge and information I'm learning back to my lab.
The scientific sessions during HRS really sets the tone for education, and it really sets the tone for guiding the practice of electrophysiology, not only at a community level, but also from a true research and academic standpoint. These meetings that happened over the last week this year is really going to set the stage for what's to come in the next 5 years. Our future is very intricately connected to everything that we are thinking about today and everything that we had done and thought about in the past.
I've come a long way in 10 years. I've been in practice as an EP for almost 8 years now, so things that fascinated me before, it's ever evolving. Things that interest me and the talks that I attend at HRS.
In terms of consecutive HRS sessions, I think this is my 12th. I keep coming back. First of all, just meeting other people from other parts, meeting my old colleagues and friends, kind of seeing what they're up to in terms of how are they treating patients now with all the new advancements and all the new technologies, and things keep changing. This is one of the few times of the year or ever where you can get together with a lot of smart people, and people that you can kind of lean on, give them cases that you don't know what to do with, and kind of see how they approach it. And at the end of the day, it's very humbling. It's an opportunity to connect, but again, learn and enrich our knowledge.
So at the very first scientific session, it was in a small room, a small group of scientists that were there discussing this new field of electrophysiology. And to see the transformation over 4 decades has been remarkable. So we came from a little group of people who were interested in this field to an international interactive society. It's been a wonderful transformation.
Well, that's it for us at the 40th Annual HRS Scientific Sessions, but we hope you've enjoyed our show and the meeting. We'll see you next year in beautiful San Diego.